Hello, everyone. We are now in Chapter 11's video. So let's go ahead and get started. This week you have Chapter 11, discussion board, and a quiz. And then if you haven't, go ahead and pull up your Chapter 11 PowerPoint that says My Notes Chapter 11. And we'll go ahead and start going through that process. So, Chapter 11 is just has the discussion board, the quiz, and one more item on there. So if you'll look at that. Then I have two slides that are basically a way of getting you to look back at a couple of the questions we had previously, and then we'll go into Chapter 11. The objectives for Chapter 11, and it's over attention deficit, hyperactivity disorder, health impairments, and physical disabilities. First of all, you'll be able to define attention deficit hyperactivity disorder, ADHD, and describe the most common treatment options for ADHD. You'll also be able to define physical disabilities and health impairments. You'll also be able to state two reasons why the number of children served under OHI or other health impairments or orthopedic impairments categories of the IDEA is much smaller than the actual number of children who have the impairments of the physical disabilities. So, another part of that, there's two others here. Next, you'll be able to listen and describe the types of causes of health conditions and physical impairments seen most frequently in school-age children. You'll be able to briefly explain how severity, age of onset, and visibility of health impairment or physical disability can affect a child's performance, and discuss the importance of a parallel curriculum for those students with health impairments and physical disabilities. And lastly, you'll be able to explain why the continuum of educational services and placement options is especially critical for students with health impairments or physical disabilities. The next slide, I want you to look and see, let me pull this up a little further. How might the effects of an acute health condition on a student's classroom participation and educational progress differ from those of a chronic condition? Put your thoughts in there and see what you think, and then we'll go to the next slide. Basically, most physical disabilities and health impairments that result in a child receiving special ed services are chronic conditions, meaning they are long lasting or permanent, like cerebral palsy and a few others. Acute conditions may be severe and debilitating, however, they are typically short term, like pneumonia and some other sicknesses. A child who has an acute condition may have limited participation in educational progress, but only temporarily. For example, a child who falls behind due to an acute illness may need remediation to help him catch up, whereas a child with a chronic condition is likely to require long-term services of appropriately intensive supports. ADHD definition and diagnosis. The essential feature is a persistent pattern of inattention or hyperactivity and impulsivity that is more frequent and severe than is typically observed. There are three ADHD subtypes. There's combined, predominantly inattention, and predominantly hyperactivity impulsive. They must exhibit 6 or more symptoms for at least 6 months or in 2 or more environments. And 55% have the combined type, or 27% have predominantly inattentive, and 18% have the hyperactivity impulsive subtype. Eligibility for special education and prevalence. Children with ADHD can be served under the other health impairments category or under 504. It kind of depends on how the team and how all of the data comes together in the evaluation. APA estimates the prevalence of ADHD at 5% of school-age children. Boys are 3 times more likely to be diagnosed with ADHD than girls. We tend to see that a lot, where boys have a higher tendency to have some of these disability types overall. The ratio is higher at younger ages, and a large proportion of the 779,000 children who receive special services under the OHI category were diagnosed with ADHD. Most children with ADHD struggle in the classroom. They score lower on tests of academic achievement. They earn lower grades in school and have more difficulty with skills that support academic achievement. There is comorbidity with other disabilities, EBD, ID, LD, autism, tic disorder, obsessive compulsive disorder, meaning that the team may have decided to put them in another category, like EBD or ID or any of these here, rather than just OHI. So the IEP team can distinguish which one they feel like will be best for that student depending on the services that student needs. The causes of ADHD are not well understood. There is no clear and consistent evidence that links brain damage or dysfunction to behavioral symptoms of ADHD. Evidence indicates that genetic factors may place individuals greater than normal risk of an ADHD diagnosis, whereas research using neuroimaging technologies has shown that some individuals with ADHD have structural or biochemical differences in their brains. Medication. There is prescription stimulant. Medication is the most common intervention. There is no clear evidence indicates that stimulant medications lead to improved academic achievement. Behaviorally based intervention, there's applied behavior analysis. We've talked about that in previous chapters, but it can also be utilized here. And teaching self-regulation and self-monitoring skills are essentially the end result, which helps most of these children. Then there's physical disabilities. There's severe orthopedic impairment, or OI, congenital abnormality like clubfoot, absence of a limb, etc. Impairments caused by disease, poliomyelitis, bone tuberculosis. There's also impairments from other causes, cerebral palsy, fractures, burns, etc. And then they all adversely affect educational performance. Remember, that's primarily in every single one of our standards and indicators. Definitions of OHI or other health impairment. Limited strength, vitality, or alertness due to chronic or acute health problems. They can be such as asthma, attention deficit disorder, diabetes, epilepsy, heart condition, hemophilia, leukemia, sickle cell, anemia, lead poisoning, nephritis, rheumatic fever, or Tourette syndrome. And again, adversely affect the educational performance. Orthopedic impairment, some of the different definitions, different ideas, involves the skeletal system, where neuromotor impairment involves the central nervous system. Chronic conditions, long-lasting and often permanent. Acute conditions of limited duration. The next two slides have a question and answer. Again, give it your best shot on the first one. Pause it and see if you can come up with the right answer, and then go to the next one. Rise of prevalence of chronic medical conditions in children much higher than the number of students receiving special education under the IDA category of orthopedic impairments and other impairments. So pause it if you want, put in your thoughts, and then we'll come back. Two factors make the actual number of children with physical disabilities and health services under these categories. First, in order to qualify for special ed services, a child's physical or health impairment must adversely affect his or her educational performance. Many children have chronic conditions that do not adversely affect their educational performance, so they do not receive special ed services. Additionally, many children with chronic physical and health impairments have multiple disabilities, and they are receiving special services under another category. Basically what it's saying is, again, that statement must adversely affect educational performance. There are many that have diagnosis of ADHD from licensed psychiatrists or psychologists, but they are doing fine in school. They may have medication, they may be doing fine. Their parents and the family and the teachers have not noticed anything adversely affecting their education. So in this case, they would not be in a category of special education. That's where a lot of times too, we will have doctors that diagnose ADHD or ADD, and then they will immediately tell the parent or tell the school district. I've even had one written down on a doctor's script saying must have IEP. Well, we've gone through the process because, of course, the family asked for it and gone through the process, and then all of a sudden, lo and behold, they don't have an adverse effect on their education. They're doing fine in their classes. There's no reason for that special education. So even though they may have a diagnosis, and the psychiatrist may have a misunderstanding that just because they have an ADHD or ADD diagnosis, they can get an IEP, they may not require one according to IDEA. Now, it also mentioned a 504. If they don't qualify under IDEA, they can, because it's a medical diagnosis, qualify for a 504 plan. Just like we mentioned before, though, a 504 plan would not have access to special education teachers, special education resource rooms. Everything would be completed and accommodations given in the regular classroom setting. So that's also a way that, reason that they might not be in special education. And then they also, also may have been maybe receiving services in another area of special education. The prevalence, talked about it a little bit, but in 2012-2013 school year, 59,000 children between ages 3 and 21 received services under orthopedic impairment, whereas 779,000 were served under OHI. These two disabilities represent approximately 1 and 12% of all children receiving special education, respectively. And again, the actual number of children served is much higher than the number receiving SPED services under IDEA, because they may be receiving it under other categories and they may not need to require our special education services. There's a couple questions there about IDEA and why ADHD is not basically a separate category, and because the federal government stipulated that students with ADHD are eligible under OHI, there's no reason to create that other service. Epilepsy, definition: when seizures occur chronically and repeatedly, they're caused by abnormal brain discharges in the brain, or electrical discharges, types of seizures are generalized, tonic, clonic, absence, complex partial, and simple partial. There is sometimes an aura or a warning sensation that takes place beforehand, so sometimes they may be able to understand when a seizure is coming on, maybe about a short time before. They can be controlled with medicine in 70% of the cases. Diabetes can also fit under this category, a chronic disorder of metabolism that occurs when the body is unable to obtain and retain adequate energy from food. There's type 1, where they have insufficient insulin, and type 2, the most common form, results in insulin resistance, and they can be hypoglycemia or hyperglycemia involved with that. Asthma can also fit under this category. A chronic lung disease resulting in narrowing of airways is the most common lung disease of children. Prevalence range from 7 to 10% of school children. Leading cause of absenteeism in school is due to this. Causes are unknown, but considered an interaction of heredity and environment. And emotional stress can cause a causative factor. Treatment involves an asthma teaching program. There's also autosomal recessive disorders inherited when 2 copies of an abnormal gene are present. That's like cystic fibrosis, sickle cell disease, and Tay-Sachs disease fall under that one. HIV and AIDS can also fall under this category. A person with AIDS cannot resist the fight off infection because of breakdown to the immune system. No vaccines or cures exist. Advances in antiretroviral drug treatment reduce mortality rates. Parents are not required to inform the school their child has HIV, and school personnel should be trained in universal precautions. The next 2 slides have another question and answer. So again, you know the drill. See if you can come up with the answer, and then go to the next slide. How might the visibility of physical disability or health impairment affect a child's self-perception, social development, and level of independence across different environments? Well, see what you think, and then we'll talk about it. The answer how children think about themselves and the degree to which others accept them are often affected by the visibility of their condition. Some children use a variety of orthopedic appliances that make their physical impairments more noticeable and make the child with the disabilities look even more different from their classmates without disabilities. The visibility of some disabilities may cause others to underestimate the conditions that are not as visible, like asthma, may decrease the inclination of others to provide the student with needed special education services. Cerebral palsy also falls under this. It's a disorder of movement and posture, a permanent condition that results from lesion to the brain or abnormal brain growth. Most prevalent physical disability in school age children. A good reminder of that. Remember, everything in red is probably going to be seen again. No clear relationship between the degree of motor impairment and the degree of intellectual impairment, if any. Classified according to muscle tone, hypertonia, and motor movement, so spastic, athetosis, and ataxia. There's now a video on cerebral palsy that I'd like for you to look at, so pause this video and go ahead and watch that video, please. Okay. Hopefully you gained some ideas and understanding of cerebral palsy, that one from London. Again, it's the most prevalent physical disability among school-age children. There's also spina bifida that comes into play and under OHI. It's congenital malformations of the brain, spinal cord, or vertebrae. The most common neural tube defect can result in paralysis below affected vertebra. Three types are spina bifida occulta, it's the mildest form, meningocele, and I'm not a doctor, but anyway, it's the most common and most severe form, the last one there. There's hydrocephalic conditions common with many children with that last one and treated with a shunt. It does require clean intermittent catheterization, which you and or your para or nurse may end up needing to assist in that. Types and causes, there's muscular dystrophy. It's progressive atrophy of the body's muscles. Duchenne's muscular dystrophy is the most common. There's spinal cord injuries that would also become under here, caused by penetrating injury, fracture, stretching, or compression of the spinal cord. Can result in paralysis. The higher the injury on the spine, the more the injury cuts the spinal cord. So you may have quadriplegia and paraplegia on that one there. Students with physical disabilities or health impairments function well below grade level academically. Daily healthcare routines and medications have negative side effects. Educational progress is often hampered by frequent and sometimes prolonged absences. As a group, these students perform below the average on measures of social behavioral skills. Concerns about a physical appearance are reasons for emotional difficulties and feelings of depression. Also include with that. Some of the variables affecting education performance. A physical disability or health impairment can limit a child's ability to engage in age-appropriate activities, their mobility, their cognitive functioning, social and emotional development, sensory functioning, and communication across a continuum ranging from normal functioning to extremely impaired. Age of onset. Children with congenital or acquired impairments may have different needs. Visibility. The visibility of the impairment may cause some to underestimate the child's and abilities and limit opportunities. Teaming and related services. They will have in this section here, there's going to be a little bit more similar to ID, where you're going to have a lot more people that could possibly be involved in the IEP meetings, not just the special educator, the regular education teacher. It might be physical therapists, occupational therapists, speech language pathologist, adapted PE, recreational therapists, school nurses, and then there might be others like prostheticists, orthotists, orientation and mobility specialists, biomedical engineers, health aides, counselors, and medical social workers may be involved in an IEP of this nature also. So make sure that as you're looking through, as you're inviting people to the meeting that you get with family, and look back at past IEPs and past records, see who you need to invite and continue to invite. Um, I do have a slide here, difference of OT and PT. You do need to understand this. Occupational therapists are concerned with a child's participation in activities that promote self-help, employment, and communication, whereas physical therapists are involved in the development and maintenance of the motor skills, movement, and posture of students with physical disabilities. So OT may be more towards the writing, skills like that they would need, where physical therapists are going to be more of the PE, motor development, walking, and things like that. More of occupational skills, maybe more fine motor, whereas the PT is more gross motor. Educational approaches, environmental modifications like barrier-free architecture, functional adaptations, assistive technology. Remember, there's low and high tech. It doesn't have to be a high-tech device and more expensive. Low-tech devices have come are still doing well in the classroom, and can definitely do the same thing in many cases. Animal assistants may have a helper or a service dog. So I know I used to have a discussion board on monkeys. I think I took that out finally, but monkeys as personal care attendants. Make sure to look at that. Proper positioning on special healthcare routines. Proper positioning and movement encourage the development of muscles and bones and help maintain healthy skin. Proper seating helps combat poor circulation, muscular tightness, and pressure sores, and contributes to proper digestion, respiration, and physical development. Lifting and transferring requires making contact with the child, communicating what is going to happen in a manner that the child can understand, preparing the child physically for the transfer, and requiring the child to participate in the routine as much as possible. I know early on, I was my first job as a teacher. I did have an adaptive PE class, and I had 2 students that were wheelchair bound. And so you will need to understand the proper techniques of transfer, and get some assistance depending on the age of the child to help with that. Lifting and transferring requires making contact with the child, communicating what is going to happen in a manner the child can understand, preparing child physically, and requiring child to, again, participate with you. Independence and self-esteem. Children need to be encouraged to develop a positive, realistic view of themselves and their physical conditions, and this will be something you'll continually work with. As much independence as possible, the ability to cope with their abilities, set realistic expectations, and accept help gracefully when needed. The ability to explain their physical disability or health condition and respond to others. Kind of, some people may call it, the 2-minute or the 3-minute elevator talk. And collaboration with self-help groups for people with similar disabilities. Basically, try to make sure they're doing as much as possible that they can on their own. Many times, especially when they're younger, other students may want to help and assist, which is great, but we do need to make sure that they are doing what they can on their own, and making sure they're developing those skills. I want you to watch now the next one, a video on ADHD, emotional and behavior problems. And this is where ADHD medication, I do want to say real quickly before we watch it, don't just assume that the child is on medication for any type of medical condition. And don't assume that the parents are bad if they don't. Many medications have a lot more negative side effects than positive side effects. I know I kind of laugh at a lot of the TV commercials. If you watch them, look at the next commercial you see and look how many negative side effects are listed below that. I mean, many of them say, death and all this other stuff. And it's like, why would you even want to take it? Well, many times, and I know I have some family experiences with this too, many times it takes quite a long time to get the right combination of meds, possibly the right amount of meds, and the side effects that go along with it. Yes, it may help in some ways, but then in others, it can be a big detriment to the child, and definitely the family too, both socially, behaviorally, and academically. So Don't just go on the kick that, hey, meds are the best way to go, because they aren't in every situation. So now let's go ahead and watch. A father refuses to accept ADD learning disability label. I think it'll give you a real good perspective. Okay, I hope you enjoyed and have a better understanding of that from the parent's perspective. Placement options. During the 2012-2013 school year, 55% of students who received special education in the category of orthopedic impairment, and 60% of those with OHI were educated, in the general education classroom. So just because you're taking this class because you need to know a little bit about those students with special education, you will see a majority of those students in the regular ed classroom, and maybe just go out for resource assistance. 16% were served in resource rooms, while 10% of those were OHI, and 22% with those with orthopedic impairments educated in a separate classroom. There's also technology dependent students that kind of comes into discussion there too. The next two slides have a question and answer. So again, let's look at the first slide, and you can give your ideas, and then we can go look at the finishing one. Of the many ways that physical environment, social environment, and instruction can be modified to support the inclusion of students with physical impairments, health impairments, and ADHD, which are the most important? Think about that, and go ahead and write down your thoughts about what you would think would be important. Well, here is what comes out. Teachers of children with physical and health impairments often find it necessary to adapt equipment, schedules, or settings so their students can participate more fully in educational and recreational activities. Although there is currently an increasing trend toward integrated children with physical and health conditions, this practice has raised several controversial issues. These issues revolve around determining the extent to which teachers and schools should realistically be expected to care for students with physical and health-related disabilities, and decisions concerning the safety of all students must be made. Perhaps the most important classroom modification is creating an atmosphere in which the student with disabilities feels socially accepted and comfortable enough to learn and contribute. So think about that. Biggest thing it mentioned was socially accepted and comfortable in your classroom. Related services in the classroom, inclusive attitudes. Controversial issues concern including students with physical impairments, special health care needs in the general ed classroom. Sorry about all that. I've got something coming up. The extent teachers and schools are responsible for a child's physical health care needs. There are several legal things that you might want to look at and know. Irving Independent School District versus Tetro. Catheterization is a related service. Remember, I talked about that earlier in this, that you, your para, and or nurse may be asked to do that. Cedar Rapids Community School District versus Garrett F. Nursing services are related services. Acceptance is the most basic need of children with physical and disabilities and health impairments again. Now, the next one has the standards and indicators. Since we've gone through this so many times, I'm going to let you do that, but click each one. There's one on other health impairments and one on orthopedic impairments. Take a look at those and get to see what the requirements are to get them into special education. So let's make sure that we've talked about everything. I would recommend you get this done early. This is just a one chapter week because there isn't a big assignment that's due at the end of this week. And you basically have 2 more weeks left. Next week, you will be back to 2 chapters during the week. So if you get done with this and your assignment, I'd go ahead and start working on chapter 13 and 14. I will probably start trying to work on 13 and 14 late this week so that they might even be up a little early. Just make sure that I have that colored in the right color so that you know that I've updated my video for that. Also, make sure you're continuing to get your DI resource from Pinterest put on there. Anyway, I'm going to try to go ahead and leave this shorter than normal, and I will let you go. You'll have a great rest of your week.